Okay, now here's the CranioCradle, and the CranioCradle was actually produced to be like an extra set of hands for you as a therapist. And it's soft like a pair of hands, and it's based on osteopathy. So the first thing that we're going to do is put someone in a stillness position. So we've done our great cervical work, and we're going to come in and place the two knobs that you see here right at the top of the occipital protuberances. Now this is where we would encourage the client to take some nice deep breaths. Inhale and nice exhales. And another thing that could be happening here as we see him start to relax, this could also be introduced in this in your treatment this time, and then when they come in the next time, you could allow them to start to relax in your treatment room as before you start your treatment. And as you can see, stillness, still point does create stillness. Then what we do is we turn the CranioCradle around, and it cradles the neck into what's called a base position. Now in base position, this allows you, the therapist, once again, it's much better than a pillow, allows you to then do some rocking, some stretching, and doing some trigger points into my trapezius. And you'll notice that my base is very stable for that. So I could have went down to the lower extremity as well as doing my upper extremity. So in the base position, another thing that we can think about is if you just see how it helps reestablish the nice C-curve of the cervical spine, and it's opening up the SCM and all of our flexors in the front. So if we had a whiplash injury, this would be great to help those flexors relax. Also, you know, in Florida, we certainly see those little old people that have their head hanging out there. And now we see young people having the same thing happen because they're over a computer all day long. So this is a wonderful tool to use after you've worked over a computer to allow all of that flexion to relax. The other nice thing about the CranioCradle, especially for my cervical routine, is to turn it on its point. Now when you turn it on its point and put it up underneath the occipital ridge, the body weight, if it's positioned appropriately, the body weight allows the cervical just to rock back and forth on it. Now you need to guide this as a therapist, because after all, it doesn't have a complete flat base, so it could slip. But it is a wonderful traction, and you just keep trying to increase the range of motion to their tolerance, of course. Back and forth. And it just releases it. It's wonderful along that suboccipital ridge, and it helps reduce the tension. And then, once I've done that, I want to turn it back around, go ahead and allow the patient to relax at the end of the session and take some nice deep breaths. And we're back into our stillness position. This is a fabulous home system. So once you've finished your cervical routine and you've also demonstrated onto the client's going to want to take one of these home with them, and it helps them in between to do a nice either stillness position because they've had a really tough day and you want to get rid of all the tension, or maybe in the base position to help relieve some cervical tension.